Now, let's talk about the condition where everything is normal. Scan is normal, the risk has come, say 1 in 20,000. There can't be anything more reassuring than that. So, the parents, as parents, you have seen the baby is good, hunky dory, the blood tests are normal. It is reassuring, and therefore, we can send you for a routine testing, and you come back to us at the time of TIFA scan, which will be around 19-20 weeks or your 5th month. So, this is very reassuring. But say, in case if you belong to the category where the test came borderline, or if the risk was increased. So the risk for the NT came like 1 in 100 or 1 in 250. Then therefore, we will require more investigations in this area. Now we want to make sure that this baby is not the one baby which is affected. We want to segregate it from the rest 99 babies. If the risk is 1 in 100, we want to make sure that this baby belongs to the 99 babies and not the one baby. How do we do it? Scan is not going to read the chromosomes or read the cells. It's only going to give us indirect markers. Of course, biochemistry has helped us, but we need something more, some other testing. And the definitive gold standard test, what we are going to do is called as an invasive testing or a chorionic villus sampling. So here what happens is we take a needle and we take some sample of placental tissue from the mother, and that is sent to the lab because that will contain the fetal DNA as well. So fetal DNA is extracted out of that, it's cultured, and therefore we study all the 46 chromosomes of the baby and we come to know whether this baby is having the suspected abnormality or not. Sometimes if we suspect if the defect is a smaller defect, that is the defect is at a deeper level than a chromosome, what is called as at the genetic level, then I may say that we may need to do a further test, not just a chorionic villus sampling with a karyotyping, but we may need to do at a genetic level test, and these all will be discussed in case if we are entering that arena. So how is this test done? The chorionic villus sampling test is also a bedside test only, but certain precautions are taken to avoid infections as well as miscarriage risk to the mother. So we take them to scan room, we sterilize all the equipment, mother is sterilized as well, test dose of antibiotics are given, mother's blood group is checked because should she be having negative blood group, then she will require anti-D injections, antibiotic test doses are given so that she's covered with antibiotics during this stage. Again, this is some clinicians do it, some clinicians don't do it, it's a precautionary thing. So we scan the baby. Again, similarly, abdominally, we place the probe, clean everything with betadine, and we take the sample after numbing the skin with some local anesthetic, putting the needle inside and extracting the tissue out. The process is a very simple process, takes 10 to 15 minutes, but most mothers are very anxious during this process because already they have gone through the mental anxiety of having or probability of having a baby with problems. So at this time, I would say the key thing is to relax yourself and postpone all your thoughts and processes for some time, because we are in the process of investigation. Let us investigate. We never know which way the baby is going to be. After all, you know, the chances of having a normal baby are higher, and there is nothing more reassuring than seeing a normal report. And when does this normal report come, or abnormal report in if you are unlucky? The report takes up to 4 weeks. So what we do is we run a quick test called as a FISH test or a QF-PCR test, which is done on this sample very quickly to look at the particular trisomy. Say we were suspecting trisomy 13 or 18, we look for those particular probes, and the test is with us within 3 to 5 days. It's a 99% accurate test. So we still have to wait for 4 weeks for us to get a complete result of the karyotyping, where we will be telling the complete result to the couple and hopefully reassuring them if the tests have come back as normal.